Hi everyone, my name is Alicia Rowland, and this is my Professional Health Education Philosophy presentation for HSC 6037, Fall 2019 for the University of Florida. First, I'd like to go over the presentation outline. I'd like to share a little bit about myself and then go over some of my personal beliefs regarding health education and promotion, share a critical past experience that has helped give me a passion for health education, and lastly, share how I plan to contribute in my health education and promotion role. So here's a little bit about me. I love spending time with my precious family. In the photo is my husband Kyle and son Tucker. We enjoy watching college football and have a lot of fun because we are a house divided. Can you believe those boys are dog fans? I'm the only Gator in the house, so I love to torture them and sing all the Gator fight songs throughout the house every Saturday. Go Gators! We also enjoy spending time on our boat, fishing, riding, and spending time at the beach. I have worked in healthcare since I was 16 years old, so I've had a passion since an early age. I was given a great opportunity to work in a local primary care office where I actually worked for the last 20 years. I worked my way from medical records to the front office and then eventually the practice manager in 2008 when I graduated from the University of North Florida with my undergraduate degree in health administration. When my office merged this year with a bigger company, I received a promotion and I am now the ACO, Provider Relations Manager. And ACO stands for Accountable Care Organization. We'll talk about what that is a little later in the presentation. I work with over 40 providers on reaching our company goals for our Medicare ACO. So, when I first saw one of the required assignments would be developing my personal philosophy of health education, I knew it'd be challenging for me. I thought, I don't have a philosophy. No one's ever asked me what my philosophy is. How am I going to figure this out? So the term philosophy is a statement summarizing the attitudes, principles, beliefs, and concepts held by an individual or group. And this is per our textbook, Principle and Foundations of Health Promotion and Education. For you to understand my philosophy of education, I want to share some values and ideals that I hold and things that are important to me. First and foremost, above all, I value my family. Other things that I value in life are my friendships, my freedom, my career, and working hard. The health of my family is very important to me as well as being kind to others. I believe to be successful in life, it is important to be hardworking, ambitious, determined, accountable, and trustworthy. So, what does health mean to me? So, to me, health is broken down into physical and mental health. I believe it is important to make healthy choices to remain physically and mentally healthy. In order to be mentally healthy, it is important to have a good work-life balance and be able to handle stressors in life and positively contribute to the community. As stated in the 2007 Sophie Presidential Address by Dr. Samuel Gimbeski, the goal of health education is to play a role in facilitating the preservation, protection, and improvement of one's health in communities. So one major event that has shaped my philosophy of health education and why I believe it is so important happened to my father about 11 years ago. My daddy is a miracle man, and he received a liver transplant in 2009 at the University of Florida in Gainesville. Prior to his transplant, he was in 2 hepatic comas due to hepatic encephalopathy. He almost died both times before he got his transplant. So in order to prevent the comas from happening, he was required to take a medication called lactulose. It was an awful medication because it caused moderate to severe diarrhea, which caused the ammonia, which is the poison, to leave his body to prevent him from going into the coma. So the ammonia level would rise and it would cause him to get disoriented, not in his right mind, and then eventually cause the hepatic comas. So upon discharge from several ER visits prior to the hepatic comas, there was no education given on the medications prescribed prior to discharge. I truly believe that if a proper education of discharge medications were given, this would have prevented or lessened the hepatic comas prior to his transplant. And even in, his primary care office, they did not emphasize how important this medication was and what exactly it was for. And I feel like that would have made such a huge difference in those two comas that happened prior to his transplant. So I feel like my health education philosophy, it's simple. I want to help people and I want to make a difference in their life. It's really a passion. By becoming a health educator, I will be able to educate and encourage patients on how to maintain the healthiest life possible, even when living with their chronic conditions. I believe by providing education regarding their disease and chronic health conditions, their medications, and how to manage them, this could greatly improve health outcomes, while at the same time saving money on unnecessary health expenses to the patient and unnecessary costs to health in general if they're more educated. So what I believe my role in health education and promotion will be is it's going to be focused on implementing certified health education specialists into our care coordination teams that are embedded in our primary care practices. In the past, the main focus of primary care practices, and it still is, was to treat and diagnose patients. This is from McManus in 2013. And I can attest to this as I've worked in the primary care setting for the last 20 years. I have seen firsthand the adverse results of patients that have not been properly educated on their health conditions, medications, and potential health outcomes. For example, one of the chronic conditions that I see that patients need the most education on before they leave the office is diabetes. When a patient is newly diagnosed with diabetes, it is overwhelming and very scary for them. I've personally seen them first diagnosed leaving the office in tears and in fear of what to do next or what's going to happen to them next. Many providers and staff run into time constraints for education when they are part of a busy practice and they have patients that are scheduled every 15 minutes throughout the day. This is just one of the many reasons that health educators should be embedded into the primary care office setting. What a difference they could make in the lives of so many people if they were just there every day, helping patients before they left the office, just being that last arm of care, for the patient before they leave the office, answering any of their questions, having someone to call directly if they have questions. I think it would just be amazing. So, also continuing to talk about my role in health education and promotion, I also believe, in order to do what I would like to do in health education and embedding care coordinators, my role is going to be more of a corporate initiative focused on our accountable care organizations. And I would like to work with an initiative with my company to embed health educators into our offices, like I was talking about. Our group is comprised of over 450 providers throughout the state of Florida, and the vast majority are primary care and internal medicine physicians. We are currently the number 2 ACO in the country in shared savings and in the 82nd percentile for quality metrics. So, what is an ACO? So, per CMS, an ACO is an organization of doctors, hospitals, and providers that come together to give high quality, coordinated care to the Medicare population that they serve. When a patient is coordinated, this helps to ensure that patients get the right care at the right time and helps to avoid duplication of services and helps to prevent medical errors. When an ACO is successful in delivering high quality care and spends the healthcare dollars wisely, the company can achieve shared savings with the Medicare program. I believe health educators would be able to play a big role in the continued success of the ACO by being part of the team that provides care coordination to these patients. The care coordination team is currently comprised of mainly nurses who focus on the top 5% of high-cost utilizers and patients that have visited the emergency room and have been admitted and discharged to the hospital. I believe incorporating health educators would add great value to the care coordination team. They would be able to provide education and health promotion to all patients, not just the top 5%. I believe providing this extra level of care for this patient population would improve their quality of life, provide a valuable education to them on their chronic health conditions, and also how to manage them. It would give us an opportunity to educate them on our Call Us First campaign, which encourages patients to call their doctor or our nurse on call before going to the emergency room when it's not a true emergency. Many times we're able to get them into the office the very next day instead of them going to the emergency room for just their cold. Not only does it save money to our company, it saves money for the patient, and the patient doesn't risk going into the hospital and contracting more illnesses or more, communicable diseases. It is just better all around for them. This can provide significant cost savings to the patient and provider. My goal is to truly make a difference in the lives of this patient population and use my health education and behavior degree in conjunction with my years of administrative experience to do so. Thank you all for listening. And here are my references.